Hi friends, I would like to explain to you in my own simple manner to patients what are the different types of fibroids which we come across. So the patients are always under the confusion that whenever we have a fibroid we need to get operated immediately. So now here we have three types of fibroids depending on the position of the fibroid. So first let me explain the structure of the uterus so that it will be very easy for you to understand. So if this is the uterus, this is the vagina, this is the cervix. So the lower part of the uterus is called the cervix. This is the fundus or the body of the uterus. This is the endometrial cavity. This is the fallopian tube, right fallopian tube and the left fallopian tube. This is the right ovary and the left ovary. So depending on the position, that is, we have three layers in the uterus. This is the outer layer, this is the middle layer, and this is the inner layer. So the outer layer is called the serosal layer. The middle layer is the myometrium. The inner layer is called the endometrial cavity or the endometrium. This is the endometrium, this is the cavity. So this is an empty space and this is the lining of the cavity, endometrial cavity, which is called the endometrial layer. So now the fibroids can occur in different places in the uterus. So these fibroids are nothing but solid tumors, usually benign. Benign means like they are not cancerous. So malignancy means cancer, benign means they are non-cancerous. So fibroids are mostly benign tumors and they can occupy any three areas in the uterus. If they occupy the outer layer, that is, suppose if they are arising from the outer layer of the uterus and they are confined to only the outer layer of the uterus, for example, this this is a subserous fibroid. Okay, suppose if the fibroid is occupying the myometrium, that is a intramural fibroid. Suppose it is occupying the inner layer, that is the third layer of the uterus, then it is called the submucus. So this is called the submucus, this is called the intramural fibroids. So this is depending on the position, this is the description of the fibroid. So the subserous fibroids are very harmless, but the intramural and the submucous fibroids are symptomatic most of the time. So the subserous fibroids, unless they become very large, they cause pressure symptoms. Suppose if they are more than 4-5 centimeters, suppose if it is at the top of the fundus, that is at the fundus of the uterus, it doesn't cause any symptoms. But if it is behind the uterus, posterior, suppose if this is the anterior part, this is the posterior part of the uterus. Suppose there is a subserous fibroid here, you have the spinal cord going behind. So because of this, if it grows bigger and bigger, it causes pressure symptoms over the vertebral column and it can cause severe backache. Suppose the same subserous fibroid, if it grows very big and it is involving the urinary bladder is in front of the uterus. So if it grows big and causes pressure symptoms over the bladder, then it causes urinary symptoms. Otherwise, usually the exophytic or the subserous fibroids are harmless if they are very small. Now coming to the intramural fibroids. Intramural fibroids are usually like symptomatic. Suppose if they are partly exophytic and partly intramural, they may not be symptomatic very much. But if they are totally intramural, as the size grows bigger, suppose if they are 3 to 4 centimeters, they may not be symptomatic. But even if there are small fibroids, sometimes they do affect consequences of pregnancy. Like they can have early missed abortions threatened abortions, blighted ovum, or miscarriages. So, such things can occur because of this, even though they are small. So, whenever there are 3 to 4 centimeters fiber, that is less than 5 centimeters, we usually don't treat them. But if this small size of fibroid is causing fertility or miscarriages, then we interfere and do surgeries for this size. But usually, if there are fibroids more than 4 to 5 centimeters, intramural fibroids, they can involve thickening, increase in the thickening of the endometrium and cause heavy bleeding or severe dysmenorrhea.